Hey guys, all right, so now we're going to talk about young adults. And so, I don't know, I think a lot of times young adulthood healthcare gets skipped because it's the end of adolescence, right? So we know that adolescence is 11 to 21. 21 people can drink, they've graduated from college, they can rent a car technically, although really 25. But they're no longer allowed to go to children's hospital. They're no longer in pediatrics, especially after age 18. There's really just not any more supervision telling them when to go to the doctor. Now they're full-on adults. They should be able to understand about going to the doctor. But guess what? Most young adults don't. No matter how educated or what socioeconomic standpoint they come from, you can ask anybody from age 21 to 30. And oftentimes you say, who's your regular doctor? And they'll be like, I don't know, I got a little clinic all the time. And that's just because, one, most of the time, chronic issues haven't reared their ugly head, especially if they didn't grow up with any chronic issues. They grew up in pretty decent nutritional environments. They might not be aware of issues that could be happening, especially with family history. And then also access to care. Most people who graduate from college don't get jobs anymore that provide health care. And the same for people who don't go to college. And for those who work full-time minimum wage jobs, the likelihood of somebody actually having healthcare access is really small. So major health problems of early adulthood are largely preventable. And many problems are linked to behaviors and conditions that have related outcomes. And a lot of these behaviors and conditions are things that we are trying to amend during adolescence, but it needs to be continued in young adulthood. So a few young adults have serious impairments that interfere with daily functioning, which is why they don't seek medical care. But those with chronic conditions, including mental health disorders, have to learn to manage conditions with increasing independence, and that's also hard. So if somebody grew up with pretty severe asthma and they've always had an adult or somebody kind of taking over their care, transitioning into that adult care is going to take a bit of work and a bit of education, and that's where we as nurses come in. So young adulthood. All right, so here are the prevention, early intervention items that we talk about in clinical care. So obviously accidents and injuries. People are still young. They're still a little impulsive. That frontal lobe is still developing. Mental health and well-being. In general, the transition from adolescence to young adult can be quite daunting. This is definitely a peak area of mental health issues. For those who understand bipolar and schizophrenia, oftentimes this can be where a psychotic break occurs for both men and women. So something to understand with that. Sexual health. So at this point, the average of those who are sexually active is a lot higher. There could be multiple partners involved, STIs, pregnancy, and then also understanding about sexual orientation and gender identity. That can happen quite young, but it's still quite pervasive in the young adult. Substance use and substance abuse, right? So again, this is an age where these issues can start to show, where they could peak. Obviously we get it younger. Sometimes you don't see it till someone's older, but these are one of those issues that you start talking about. Then there's chronic illness for those who are either starting to get it or have had one. They have a high family history of it. And then obesity and eating disorders. So the global burden of disease in young people aged 10 to 24. So, we talked about all those things. The number one issue is depressive disorder. And that is from 10 to 14, 15 to 19, and 20 to 24. So then we have road traffic accidents. People are drinking now and driving. Violence, so domestic violence, homicide. The number one cause of death among young African American males aged 20 to 24 is homicide right now, which is just awful. So gun by death homicide. Just keep that in mind. HIV and AIDS is still a huge issue. Schizophrenia, bipolar, we talked about ages for when they have first psychotic break. Tuberculosis, and part of that is because if you're poor or you're living in crowded environments, self-inflicted injury due to depression or suicide, alcohol use, and abortion. So all of these can actually be prevented with the preventive services that we have in healthcare. So mortality by cause, sex, and age group. So among male, obviously it's other. And then suicide's hard, motor vehicle fatalities is the second cause. Females, as you could see, motor vehicle fatalities, suicide. Look how large the cause of death in males for homicide is. And then others that come in there will be substance abuse, what do you call it? Other accidents, and chronic disease or acute disease. So chlamydia rates by age and sex, in the United States from 2013, you can see we have really high rates of chlamydia. So untreated chlamydia can cause PID in women, which is called pelvic inflammatory disease. It can be fatal, actually. It's really dangerous. And you can get epididymitis and prostatitis in men. So ages 20 to 24 are the highest rates of chlamydia. It's obviously quite high in 15 to 19, but I mean, look how the difference is for 20 to 24. And then it goes down after that. Not to say you shouldn't screen anybody with high-risk sexual behavior. So you can have someone in their 40s who have high-risk sexual behavior, and that merits a chlamydia screening. But in general, from 20 to 24, everybody is screened for chlamydia because of this really high rate. Here are the rates for gonorrhea. And the diagnosis of HIV infections is highest between ages 20 to 29. But look how high that is. That's crazy. So again, why we will regularly screen people at these ages. Versus someone else, you would do it based on risk factor. And so what I mean by that is we don't just throw out an HIV screening on provide an HIV screening on every single person just because of their age, right? Because that would be a waste of resources. But in general, in healthcare, age 20 to 29, this will be offered to everyone regardless. Now, am I going to offer an HIV screening to people age 60 to 64 without risk factors? No. But if they tell me they had blood transfusions, they were in the military, they shared needles, they had diabetes, any of those risk factors, you'll screen them. And actually, the CDC does recommend HIV screening once for those over the age of 60 to 64 because there was kind of a rate in the baby boom, specifically actually with Hep C. So then we talk about chronic conditions in young adults. So let me just move this down a little so you can see. All right, so obesity, 19.5%. Asthma, hypertension, heart conditions, ulcer, cancer, and diabetes. Okay, now, as this obesity rate goes up, so will hypertension, heart condition, and diabetes. Asthma is still a high issue, and I'll say that asthma control rates are going to go up or go down in young adults because they don't have anyone supervising their care. Sorry. So past year, mental health and substance use in 2013. So this is actually going up. Remember that we don't get all this data. It gets collected and then published. So every few years. So this is the most recent that we have. So serious psychological distress, 22%. That is a lot of people for females. Alcohol abuse and dependence is really a lot higher in men. Major depressive episodes and drug abuse and dependence. And that's actually going up. So abrupt changes at 18 and older. So healthcare system changes at age 18, right? You have your change in legal status. Sometimes you lose eligibility for insurance if you're not in school. That has gotten better with the Affordable Care Act. You're allowed to stay on until age 26. And I think actually age 21 if you're not in school. And then there's limited models for transition to adult health care. And we talked about that, how we're trying to create a model for adult transition to care. And there's little preparation for changes in systems for young adults and families. So having that education piece for young adults on how to transition to care.